All right, so we're going to talk about cognitive disorders. So one of the hot topics is dementia, and there's many different types, but the most common one is Alzheimer's. But there's frontotemporal, Parkinsonian, Lewy body dementia. There's various types, but really the one we often talk about is Alzheimer's. It's almost like basically we're supposed to die before the brain ages, right? So that's kind of the theory behind Alzheimer's. And there's various medicines like memantine, donepezil, that decline the rate of dementia, but there's no medicine that stops dementia. Um, so it's kind of a sad disease because it's almost like your brain's not working and you can't control it. And people a lot of times develop anxiety because they're recognizing that their brain is not functioning kind of the way it used to be. And so basically, we'll go over the symptoms, right? So here's a great way to remember it. So memory lapse, literally. So one out of these six symptoms. So memory, language, attention, so complex thinking, complex attention span, perceptual motor deficits, social cognition, and executive functioning. And I'll go over that further in detail during another lecture because I'm going to go on to the next one. So that's kind of like a chronic aging of the brain. Now, delirium is the opposite. It's just like fluctuation because of a medical cause. So the great way to think of it is a medical frat. So the person needs all five of these. So medical cause of cognitive impairment, it's a fluctuating course, a recent onset, attention impairment. So they're like, you see them in the morning and they're alert, and then at nighttime they're completely out of it, or vice versa. So it's like waxing and waning of alertness. And thinking cognitive disturbances. So delirium is a medical illness. So that's why it's part of the medical fraternity to diagnose it. And all five symptoms must be met.